NCD has released multiple reports regarding the perils that people with disabilities face before, during, and after disasters. From the risk of institutionalization because shelters are not equipped to provide essential services, such as personal care assistance, to having no option but to shelter in place because of the absence of accessible transportation. The global mortality rate of people with disabilities in natural disasters is 4 times higher than that of people without disabilities. Census Bureau reported on the outcome of people with disabilities before, during, and after disasters. These findings were disturbing, to say the least. They confirmed NCD's findings and need for continuing change in programs and policies in disaster relief and recovery for people with disabilities. The Census Bureau Household Pulse Survey revealed that 70% of people who are deaf and displaced reported living in unsanitary conditions a month after a disaster, compared to only 7% of people who are not deaf. More than 74% of evacuees who are unable to walk reported experiencing food insecurity 1 month after a disaster, compared to just 9% of people without a mobility disability. Additionally, approximately 1% of all U.S. adults were forced to leave home in the past year due to a disaster. In contrast, 31% of adults unable to care for themselves had to evacuate, and 21% of people who are blind had to evacuate. 73% of people who are blind and never returned home after being displaced, compared to only 6% of sighted people. These statistics highlight the disparate outcomes of people with disabilities before, during, and after disasters. NCD has released multiple reports over the years highlighting findings and providing recommendations, urging FEMA and state and local tribes and territories to coordinate with the disability community and disability-led organizations as a part of emergency preparedness operations, and use the disability community and organizations as a resource in response and recovery. Forming memorandums of understanding with the disability-led agencies prior to the disastrous event so that the independent living centers and other disability organizations can receive reimbursement for their efforts. Some strides have been made. FEMA has updated their guidance and provided training to nonprofit agencies, as well as state and local tribes and territories of the legal requirement to provide personal assistance services in shelters. In the spring of 2024, FEMA amended their individual assistance regulations to account for losses that assist in activities of daily living, even though the reimbursement may be for an item that is not typically thought of as an assistive technology device, but is used as such for that individual, like a cell phone, computer, or a tablet. However, statistics show that we have a long way to go in the preparation and recovery of stages to be inclusive of people with disabilities. We are fortunate today to have 3 panelists who luckily have survived some of the most recent disasters. Keely Cat Wells, impacted by the LA fires. Lawrence Carter Long, impacted by the Asheville, North Carolina flooding. And Molly Burke, who is also impacted by the LA fires. The saying goes, if you've met one person with a disability, then you've met one person with a disability. Each one of our panelists' obstacles and barriers they faced and experience is unique to them. I am grateful to all of them for their willingness to share their stories. Keely Cat Wells has worked to advance disability rights. As CEO of Making Space, a talent acquisition and learning platform, it equips disabled professionals with resources and opportunities to build meaningful careers. She has partnered with NBC, Indeed, Netflix, and Visa. She is the co-founder of Making Space Media, which produces film and TV content centering around disability voices. A recent documentary, Fight to Fly, is a critically acclaimed film exposing the inequalities for disabled travelers face. Keely is a 30 under 30 honoree, youngest ever presidential leadership scholar, a White House Mental Health Youth Action Forum leader, and on the advisory board of Lady Gaga is Born This Way Foundation. We are very fortunate to have Keely with us today. Keely, can you share your experiences with the LA fires?
Thank you. So for a bit of background, I live with chronic illness, chronic pain, an ostomy, and various other disabilities. I've been living in LA for the past 6 years now, and I've spent 2 of those years living near Lacra Center and La Cañada Flintridge. And for those who are not familiar with LA, that is about 10 minutes from Altadena. At roughly 5 a.m. on Wednesday, January 8th, my husband and I evacuated from the Eaton fire. We made the decision to leave, not because we were notified, but because we saw the smoke and fire coming over our hill. When evacuating as disabled people, we usually have to consider much more than just packing a bag. The main thing for me personally is making sure that I have my medical supplies with me. Many of my supplies cannot be got in America, and I have to get them from abroad, which makes me even more conscious to make sure that they are secure, safe, and I have enough with me. I also cannot drive, and I do not know what I would have done without my husband. I think evacuation plans often assume that disabled people or everyone can evacuate independently. Thank you. But I think that is a very dangerous assumption to have. Many disabled people, myself included, cannot evacuate independently. During the fires, many people couldn't reach shelters because bus stops were either inaccessible, sidewalks were inaccessible, or paratransit wasn't an option. If you've been to LA, then you probably know how far people live from their nearest bus stop. If you're a wheelchair user and did manage to reach a bus stop, there was no guarantee that you would be able to get on that bus because usually public buses only have 2 tie-downs. Additionally, I've been trying to find out where people were notified about which buses were running, which shelters were accessible, and which of those buses were going to what shelters. I have not been able to find any information about how people were notified about those buses. We were not at any point notified about buses, routes to shelters, and we actually at no point got a notification even though our house was in an evacuation zone. One last point on that, I think by not being over-prepared, we were under-prepared. Thank you.
Thank you, Keely. This is Amy Nicholas, the Senior Attorney Advisor at NCD, is helping to moderate the panel with Kim. And Keely, you had mentioned that you are on the board of the Disability Community Resource Center there in LA. Can you talk about what they did to help prepare for the fires before, during, and after?
Yeah, absolutely. So the DCRC, they received many calls from disabled people who wanted to evacuate early but couldn't evacuate. They were unable to leave, they weren't provided with the resources or support or paratransit to be able to get out. They also made over 800 personal phone calls to individuals that they serve to enable them and equip them with the information that they needed to be able to get out and to get what they needed. They consolidated all of the various information that was being thrown at people, whether it be through social media, through the news, through the city, county, and various other sources, and they consolidated all of that information and made it available to them via the phone. And I believe that saved many lives during the fires. So I think that really leads to the need for centralized and accessible systems where people can quickly find life-saving resources like transportation, information, so medical supply stockpiles, and also shelter locations. And I think we need to know more information about what those shelters provide as well. We need to know what kind of storage they have available for medical supplies. Do they have the relevant equipment needed for people who use ventilators and various other accessible requirements. And for those who lost their homes or lost their property or their vehicles, they were going through a lot of complex systems to be able to get FEMA support, to contact their insurance. It was a very complex process, many of whom are still dealing with administrative challenges. And a lot of the technology that they needed to use, the sites were inaccessible. I put together a group of over 150 volunteers to support people with administrative challenges, specifically disabled people and elderly people. People were finding it very overwhelming and very complex. And I understand that FEMA did have a walk-in center to support people with paperwork and using the site. But we have to consider those who do not have access to paratransit or cannot get the transportation needed to go to one of those walk-in centers.
Right, and that's pretty impressive with the independent living centers. Something NC has recommended over the years is for memorandums of understanding be established with the independent living centers prior to an emergency. Because at the moment, what they're doing in LA and most independent living centers are not funded to help in emergency management. And so they're doing it and stretching their very thin budgets to help in the state of an emergency. One of the recommendations that NCD has made in recent report and prior reports is that DHS, FEMA, and HHS ACL grant funds to support independent living centers so that they can be at the forefront of helping to in emergency preparedness, resilience, and recovery. It's thank you so much. And you did mention, you touched on the fact that FEMA and the paperwork for FEMA can definitely be onerous. And it's something else that NCD has recommended over, I think, almost every report, is that with the Section 508, the accessibility of the website so that everyone who needs to access it can access it, including those who use screen readers and who are blind. It's I know that FEMA did eliminate just recently in that March 2024 that we mentioned earlier, some of the onerous paperwork required to access benefits, but there's definitely a long way to go. It's room for improvement always. Next on our panel is Lawrence Carter-Long. He is a communications professional and disability advocate. He has a career dedicated to enhancing the disability and representation of people with disabilities in media, public policy, and government outreach. He was actually a part of NCD's public affairs, woohoo, welcome home, from 2011 to 2017. His career spans multiple facets of media and communications. He was the role as curator and co-host of the Projected Image, which was a history of disability on the Turner Classic Movies. He has provided insights on disability representation via NPR, PBS, BBC, The Atlantic, USA Today, and the American Film Institute. Lawrence, welcome home.
Thank you, Amy. It's good to be back. And you know, it's interesting as you're going through the resume there. One thing I never could have imagined for myself, despite all of the work in public media or in public affairs here at NCD, would be disaster survivor. In my own case, I had moved to Asheville, North Carolina, a population of about 95,000 people, from Oakland, California, which is about 500,000 people, 3 weeks before the storm. So I had had email conversations back and forth with members of the independent living centers and the state councils on developmental disability saying, hey, when you get settled, let's have a coffee and compare notes and see what the lay of the land is in North Carolina. Nobody saw a flood coming. So this was September. I moved over Labor Day weekend. The flood hit on September 27th. So just 3 weeks, just a little bit over 3 weeks after I got to town. So had a basic knowledge of even how to get to the grocery store at that point. And all of a sudden we had a situation where the month of September in Asheville, which is in western North Carolina, had unprecedented rain, record rainfall, broke every record in the book for that entire month. So what had happened before Hurricane Helene hit was that ground was softened up. It was already saturated with water. So by the time Helene came, it couldn't handle anything else. And so with Helene, we had two rivers, different parts of town, the Swannanoa River and the French Broad River, the French Broad cresting at 21 feet. When I went to see it the day after the flood, a little over a mile from my home, it was at nearly 21 feet, surpassing previous records that happened in 1916 and a previous flood in 2004. So there we are. And Amy, if you'll indulge me for just a moment, I'd like to walk you through a little thought exercise, right? Communications work is all about storytelling. So if you could imagine, just kind of close your eyes or sit still for just a minute and put yourself in the place of some folks, right? So you're there. The area does not have electricity. There's no internet. The cell towers aren't working. The Wi-Fi doesn't work. You don't have batteries for your radio. You've got several days, you don't know how many days of uncertainty in front of you. And all the resources, all the things you've counted on are disrupted. This is very similar to what Keely described earlier. So you're blind or you have a visual impairment. The storm has altered the landscape. Street signs are gone. Debris is in your walkway. And the familiar route that you take is unrecognizable. It's got debris there. You rely on a cane or a seeing eye dog, but the audible crosswalk signals aren't working, right? And your rideshare apps don't work either. So without internet or phone service, how do you find safety? How do you get where you need to go? How do you evacuate, right? So you're in Biltmore Village, near the French Broad River. You're deaf or you're hard of hearing, and there are emergency sirens, there are public announcements, there are spoken directions you can't make any sense of. Phone service is down, so you can't text or video call anybody for assistance. You see folks kind of looking to the left or looking to the right, but without clear visual communication, you don't know what's going on. How do you get the life-saving information that you need? You're in the River Arts District, the most affected area that literally washed down the French Broad River. You have a mobility impairment. Roads and sidewalks are blocked with fallen trees and debris. You can't get out of your building because the elevator isn't working, because the electricity is down. How do you evacuate a multi-story building or to even reach a shelter? If you use power-dependent medical equipment, such as an electric wheelchair, and you didn't charge it that night, how do you even get around inside your apartment? You're autistic or you have a sensory-related disability. The environment outside your home, your neighborhood, is chaotic. There are loud noises, there are flashing lights, there are crowded shelters if you manage to get out. There are unexpected changes to your routine that you have put in place for yourself. Your usual coping strategies, your noise-canceling headphones or your weighted blankets, weren't taken with you to this shelter. So they're unavailable. How do you regulate stress and navigate an unpredictable world without those supports? You have an intellectual or a cognitive disability, and I heard multiple stories from peers who did support work for people with intellectual disabilities. You don't answer texts. You don't have internet, phones, or clear visual communication. It's hard to understand. Your support workers haven't shown up for 3 days. What do you do? How do you advocate for yourself? How do you find food and water when the taps aren't working and the water coming out of the tap is black or brown and it doesn't look safe to drink? How do you understand where to go or how to get help? You have a mental health or psychiatric disability. There's a lot of stress going on. All of a sudden, the lights aren't working, the phone's not working, everything is unpredictable. The anxiety is amped up, the depression is amped up, maybe your PTSD is triggered if you're a veteran who has returned from a war zone. If you rely on routines, therapy, or medication, and you can't get any of those three, how do you cope when it's disrupted? How do you access mental health if the cell towers are down and you can't reach your therapist? But if you need feeding tubes or durable medical equipment, right? You rely on power for a feeding pump, a ventilator, or other life-saving equipment. You're in North Asheville, right? But the electricity has been down for days. How do you keep your medical supplies sterile and functional when the water isn't working? How do you find a power source when the backup battery runs out? If supply chains are disrupted, how do you get those crucial medical supplies? You know, you are a senior living in a supportive living environment. You've got dementia or Alzheimer's, and the disruption has left you confused and disoriented. You know, you may not remember that a hurricane came by, where you are, or what you're supposed to do, and your caregivers didn't come to work that day, right? So you might not be able to recognize danger in terms of going outside or following your routine, and people assume that you understand those directions. How stressful, how anxious-making everybody turning you around and changing their stories about what you're supposed to do. The toilet isn't working. Where do you go? To the bathroom. These are the situations that people faced in Asheville, North Carolina. We did not have electricity where I live in West Asheville for almost 2 weeks. We didn't have internet for nearly 4 weeks. We didn't have drinkable water for 6 weeks. Highway 40, one of the biggest thoroughfares in and out of North Carolina, going into Tennessee, where you might go if you were told to evacuate, just started service again on March 1st, right? So if the roads in and out of Asheville are both washed out, and the two rivers that you live in between have flooded, where do you go? Even if you get that message to evacuate, what is open to you, right? Those are the real situations that I faced and that other people in Asheville faced with Helene.
Right. I mean, and Lawrence's experience is sort of unique. I mean, you had told me in prior conversations that you moved to Asheville because
I wanted a quality of life. I changed it. I've lived in, places like New York City and Washington, D.C., both cities, 3 different times in my life. And we sort of jokingly, me and my partner, would say to each other, I turned 57 last year. I was looking for a lifestyle that was a little slower, a little saner, a little more predictable, right? So where do we go? We go to Asheville. So Asheville, I think, like I said earlier, was a population of 95,000. It takes about 15 minutes to get from East Asheville to North Asheville or any other point in town. During rush hour, it might be 17 minutes. Right? And so the whole idea was to sit back, kind of take a break, work at about 70, 75%, and stop and smell the roses, look at the pretty leaves in the fall, go and get a coffee,
Right.
And so all of those things, we had about 3 weeks of it, right, to kind of establish that routine. But then the reality was the storm hit. Nobody saw it coming. There hadn't been a flood like that since 1916, so well over 100 years. But we were all in it together. And so there was that first week in particular, the roads had washed out. The only way in and out of Asheville was via the airport, usually via helicopter. And disabled people do what disabled people do best. We are experts at navigating a world that wasn't built with us in mind. It's like jazz. Where's the beat? How do I adapt? Where do I come in, right? I think there's a lot that disabled people can teach the rest of the world in these situations because we're used to doing it. We've had years, decades, lifetimes of experience in putting those things together, and that's exactly what happened. There was a ad hoc group that included the North Carolina Council on Developmental Disabilities, local independent living centers, advocates like myself. People just said, okay, those of you who can get to a phone or have a working cell tower, the storm hit Thursday, stopped on Friday. By Sunday, people were setting up these calls and talking to each other and starting to share information. And for my part, I couldn't take part in those because our cell tower was down. I had to go a mile down the road at the fire station, find a Wi-Fi signal, and then in order to send the message out or to let people know that we were safe.
And so you had mentioned, or one thing that I want to bring up as well
Yeah.
is regarding the independent living centers or even just the disability community in North Carolina. We had talked also about the relationship between them and the emergency managers of A, North Carolina, or B, Asheville area. And you had mentioned that there had not been a state disability coordinator for 5 years.
That's right. There had been in the state of North Carolina disability services, I might have the title wrong, but service coordinator up until 5 years ago. That position person left and it had never been refilled. And so, you know, you don't know you need it till you need it, and then you really need it, right? And this was one of those circumstances.
Right.
Where it was very important for, you know, I'm a communications guy. So one of the most, what do you want when it hits the fan, right? You want to know what's going on. You want information. You want accurate information. First thing you want is to be safe, right? Then assuming you're safe, or you find a place where you can be safe, you want to know what you need to do next to remain safe. You want to know where you can find food, where you can find water, where you can find other people, batteries for your radio, whatever the thing might be. And the communications broke down because that chain had not been established and was not already in place when the storm hit. So, you know, ultimately, what you need is a situation where you've got a state coordinator who can connect with federal officials. That state coordinator then connects with people on, let's say, a county level. And then from the county level, you got people within those individual zip codes within the county who coordinate with each other and share with each other. And then I think you have to, you know, have a designated person who can then report. You got people out in those situations doing the work, literally delivering water and diapers to senior citizens, as my partner and I did. When we were finally able to get gas for the car. But somebody who can communicate that information to other people, and you can evaluate where the greatest needs are, who can do what, at what point in time, in order to make sure those needs are met.
Right, I mean, and as Asheville, North Carolina showed, I mean, no city is safe. I mean, a disaster can hit at any time and in any city.
Right, part of the calculus that we did when we moved to Asheville is you look at the marketing for the city, and it was, you know, it's temperate climate. It's pretty calm year round. You're not going to get anything that's unexpected. It was called a climate refuge. Okay, and what I think we're realizing now, given the weather conditions and situations, both in this country and around the world, is there's no such place as a climate refuge now, and that we need to prepare for the worst case scenarios, like you were saying, Keely, so that when things do happen, we've got those systems in place in order to address them adequately.
And that is something that we have definitely, NCD has made multiple recommendations over the year and worked with the different disability organizations as well as federal agencies to try to keep forging that path so that that connection is there. And to use the words of our late chairman, our house is on fire when it comes to disaster management. We need to do something now. We cannot wait any longer for more disasters to hit and more people with disabilities to be
the reports have been written. The case histories have been recorded. The anecdotes have been shared. It's very clear that the thing that's left to do is to act. And I would just add to everything that you said, Amy, that people with disabilities, all of those types of disabilities that I mentioned, all of those scenarios that I brought up, need to be involved in the process every step of the way.
Lawrence, thank you.
Thank you.
And then our third panelist is Molly Burke. Molly's a speaker, content creator, model, author, and advocate. I have all underachievers on the panel today. And she has over 4.5 million social media followers. At 4 years old, Molly was diagnosed with a rare degenerative eye disease, which caused eventual blindness. Molly has spoken at the United Nations in New York and the World Economic Forum. She's helped pioneer, sorry, Molly, I lost my other page. It's, I've lost your bio. I apologize, ma'am. All right. So anyway, Molly, if you would like to pick up where I left off with your lovely professional background, please tell us your story or share your experience.
Yeah, thank you so much. So I was born and raised in the Toronto, Canada area. And growing up in Toronto, I was not at risk for things like wildfires and earthquakes, things that I then became at risk for when I moved to Los Angeles 7 years ago. So growing up, taking life skills classes for the blind, getting O&M lessons, those were never conversations that were had of what would you do in a natural disaster. And when I moved to Los Angeles and I started receiving O&M training in my new community, it was also something none of my O&M instructors brought up. And I'll admit that it's something I never thought about. Growing up with the privilege of not having to think about it, it really didn't enter my mind when I started my new life 7 years ago in LA and was trying to build a life there for myself, trying to make new friends, growing my career, traveling a lot, just decorating my new home. There was so much on my plate already that I didn't think about the fact that, oh, wait, there's things like earthquakes and wildfires that I am now at risk for. And I think unfortunately that's the case for so many people, is we don't think about the fact that we're at risk or what we would do until it's too late and until we're already in the situation. So that's certainly how it was for me. And I'll backtrack a few days prior to the 7th when the fires broke out. My partner and I lived together in an area of Los Angeles that historically is not at risk for fire. I just moved to the neighborhood 6 or 8 months ago, so it's still a pretty new neighborhood for me. It is less walkable than the neighborhood that I had come from, so I do more heavily rely on my partner now and his vehicle to help me get around. And I admit that I do not know all of my routes independently yet. I have my handful, but I do not have all of them yet. And so I do rely on my sighted partner to help me with certain things. And 2 days prior to the fires breaking out, his car broke down. So we were without a vehicle for a few days. We did not think much of it. Thankfully, on January 7th, he picked up his car from the shop. And we often think about how lucky we are that that was the case. That day, we were dealing with a lot of our own stuff, with work and with life. And we were getting texts from friends about the Santa Ana winds and about the fires. But again, being in a neighborhood that is not at fire risk, historically, we were not concerned. Santa Ana winds are nothing new for us Southern Californians. We deal with it every year. So we weren't thinking much of it until that evening when we went to the dog park. And we realized that the Santa Ana winds were much worse than we're typically used to. And we saw an electrical box explode in front of us. And that was the first moment in our minds, which was around 5:30 p.m., that something was a little bit different this year. And then on our 2-block way home, 2 blocks from the park, we got caught behind a fire truck because more electrical wires were smoking. And that's when we really started thinking, this isn't normal. And at that point, again, I'll admit, we still weren't thinking that we would have to evacuate. We were more so just thinking about the fact that these Santa Ana winds were worse than usual, and it was getting a bit eerie. It felt very apocalyptic, was the easiest way to explain it. We started hearing nonstop sirens, and then at 7:30 p.m., we lost all power. And with losing power, we lost, of course, all of our lighting. We lost access to Wi-Fi and all internet. And what I didn't expect is we also lost cell service. And that was when it really hit us, that we were not in a good situation. I looked at my phone and I realized I only had 30% battery power left, because I'm somebody who uses my phone all day. As a blind person, it is my eyes. There are so many apps that I rely on all day, every day, to help me navigate the world safely and independently, as much as possible. And so I'm somebody who uses my phone all day, and I charge it at night when I sleep. It's 7:30 p.m., so I'd already been using it all day. And I realized I have 30% battery left. I have a lot of things that I need my phone to do for me, and I have no access to charging it. This is the moment that my partner and I began to pack our go bags. And we were still choosing to shelter in place because we were not yet in an evacuation zone. And so we felt like, let's pack bags and be ready, but we'll stay until we know that we should go. And I think until you're in the situation, it is so hard to know what you're going to think or feel. And I can't express enough how difficult the choice to stay or leave becomes. When you are not under immediate evacuation, but you know you may become under evacuation, it is such a stressful time because you're trying to navigate so many decisions under such unknown circumstances. And we could not check fire maps because we had no Wi-Fi. We barely had cell service, so between spotty cell service, we were texting friends and saying, please text us updates, you know where we are, let us know when or if we need to go. Thankfully, by the grace of God, my parents had given us just 2 weeks prior for Christmas an emergency kit, an emergency preparedness kit. And in that kit had a crank radio. So we took that out, we cranked it, lit some candles, started packing. And again, that's when I realized things like Be My Eyes, for example, which is an app that I would use to help me with finding certain things that I need, I couldn't use. And so I realized that I was going to have to, again, rely on my partner for certain things that was taking time away from him also preparing, which meant our time for prepping to leave was increased because I lost access to tools that allow me to be independent. We decided to stay in place overnight, and by the next morning, we had continued to be hearing sirens all night, not having lights and cell service, and the lights finally came back on, and my family said, do you want us to get you flights? If we book you flights to come stay with us, can you get to the airport? And we just looked at each other and we said, yes, let's get out of here because we don't know what's coming. And so we got in the car and we left, and were able to get to Vancouver, Canada, where my family lives. And the 3-hour flight, by the time I landed, my neighbor had texted me to say that we were under evacuation and we had a fire within a mile of us. What we now know was our fire was one of the arson fires. Somebody taking advantage of the circumstance and lighting their home on fire because they had been unable to sell it and they wanted insurance money. But of course, at that point, that was unknown. And so we had a fire a mile from us. Our whole neighborhood was evacuating and we were in gridlock. Our neighborhood was in gridlock and they had to send police in to help direct traffic so that people could safely get out. And it was in that moment when I was finally safe at home with my family, far away from the immediate danger, that I was able to come out of the shock and start to realize all of the things that went right, but equally how many things could have gone wrong and how terrifying that is. Realizing that if we did not get my partner's car back, how would we have gotten out? If my partner had been on a business trip when he's out of town, you know, I have 2 different friends who I let know when he's gone, and they know if I have a problem that I'll be calling them and one of them will come help me. But they live about a 20-minute drive away, which in a normal circumstance is totally fine. But they were equally in evacuation zones, and when you're dealing with a natural disaster, like, they can't come 20 minutes out of their way to help if I needed it. I realized that I had no idea what I would have done without him. And equally, I realized the increased burden on him to help me. I really lent on him to make the choice of whether to not to evacuate. And I kept saying to him, like, I trust you to make the choice, because I knew that being unable to look at the maps, being unable to look at the images on the news or on a social media feed, I truly had no concept of how bad it was. And I knew that I was likely underestimating how bad it was, because we're so used to hearing the media catastrophize things, that we're so used to hearing the media talk about how bad things are and assuming it's not as bad as they say. So I knew that without being able to see the images that everybody else was seeing and look at the maps visually, I was probably not grasping the gravity of the circumstance. And equally, I had never been given access to tactile maps of Los Angeles. So in a city that has so many pockets, that is not a grid city, and that is very widespread, I never had to learn the geographical location of everything. But I realized in that moment that not knowing the layout of Los Angeles, having never had access to a tactile map, meant that I did not understand geographically where the fires were in proximity to me, which made me feel so incredibly vulnerable and scared. And I felt very helpless. And all I was being told by my loved ones and my partner was that we were being surrounded. That was the term that kept being used, that our pocket was being surrounded. And that was a really scary realization. And so once we were out and safe, I started thinking through all of these things. If he was gone and my usual people who are there to help me if I need it weren't able to get to me, what would I have done? If I had chosen to evacuate ahead of time, my only option would be to call an Uber or a Lyft, which I'm frequently denied access to because of my service dog. I don't know if this is an issue in other cities, but in Los Angeles, even if I do call a pet-friendly one, I'm often denied because my service dog is 80 pounds, and Los Angeles is very used to small dogs, small dog breeds. And so I'm often still denied access. I've also been experiencing issues where I order a pet-friendly Uber just to avoid issues, and they come and they say, I never signed up to be a pet Uber. So it's like a glitch in the app. So the amount of times that I get denied access, and when you're trying to evacuate, getting denied access and having to call a new Uber and get in fights over your basic human rights to access that vehicle, you don't have time for that. And I thought, okay, so if we had waited it out and we ended up being stuck in that gridlock, people were fleeing from their cars on foot. I'm not able to just get out of the car and run the way a sighted person can. And all of these things were playing through my mind. I was thinking through the fact that if we were there or if we go back too soon, the air quality is so poor that not only are my partner and I at risk who can put masks on, filtering masks, but my guide dog would be at risk to get sick. And my guide dog getting sick from the smoke inhalation is not just a pet getting sick, it's my mobility aid, it's my independence, it's my freedom. All of those issues that you brought up, Lawrence, about navigating streets, Santa Ana winds, trees get knocked down, branches fall, blocking all the paths that I would be used to walking. If there was, say, a designated spot that had been assigned for paratransit, where if I was alone, I could get there. If I didn't have orientation and mobility lessons ahead of time to know where that was, or even if I did, but there was a lot of new obstacles in my way, as there often is from Santa Ana winds, how would I get there independently? All of these things started going through my mind, and that's when I saw the news that the death toll at that point by the 9th was 11 people, 3 of whom were disabled, 1 of which was blind. It really hit me that this is an issue that we need to talk about.
Thank you, Molly. I know both you and Keely had brought up the mention or that you don't drive. And again, with the bus stops in LA, I think that one of you or both of you mentioned that they are not accessible. And with the paratransit, as we all know, we need to plan well ahead to even have them pick you up. And so that's not even an option in an emergency. And as you mentioned, yeah, there were several news releases of the LA fires in which people with disabilities were losing their lives because they were waiting on transportation, waiting for someone to come get them because they couldn't get out on their own. You were fortunate, as you very well know, to have partners to help you get out of there. And the lack of transportation, though, for evacuations during and after a disaster, unfortunately, is a broken record. It's an ongoing issue. And I mean, local governments face transportation resource gaps during blue skies. Unfortunately, those gaps turn into chasms, as we very well saw in moments of disaster response and evacuation plans. And there has to be a way there has to be some magic pill, some magic recommendation that we haven't thought of or that we have thought of and hasn't been implemented yet in order to take care of the transportation needs for people in emergencies or in disasters. We did recommend that all states, local, tribal, and territorial governments incorporate some sort of a provision for accessible transportation in their emergency operation plans. What we suggested is that go ahead and start setting up contracts, agreements, and MOUs way ahead of time. It's to support the demand in an emergency. And those contracts should include emergency requirements as 24/7 operation, availability on short notice, so no paratransit. It's with the cost being charged to the jurisdiction instead of the person. And they don't even need to be commercial contracts. They could just be mutual aid agreements.
Exactly.
But to make sure that it's across the board so that if multiple counties get hit, there's still enough coverage for that to take place, so that we don't have loss of life, disabilities, simply because they can't get out. And then Molly, another thing that you had mentioned was your lack of access to a tactile map. Would you have had any idea as to how to access a tactile map or go to get a tactile map prior to this?
As I mentioned, I took O&M lessons when I arrived to Los Angeles, and it was just something that was never offered to me. And I never thought to ask because LA is famously a city that you need a car. So I always knew moving to Los Angeles that Ubering and lifting around was going to be my life. And so I really felt like I only need to know my neighborhood. That's the only area I'm walking. And that's the only area that I need to really have a geographical understanding of. And the rest, I'm Ubering and I'm being dropped off where I need to be. So I never thought to ask anybody to provide that to me. And obviously I realized in the moments when the fires were happening, what a mistake that was. But other than asking an O&M instructor, I honestly don't know where I would begin to
even
have
get to
access to one.
Got you. And I know FEMA does or had created an IPAWS system. It's an integrated public alert warning system that is available for states and local communities or counties to use. At the moment, I believe there's close to 2,000 counties that are using them or using it. What that does is it pushes out the alerts in multimodal forms, so that if there is a graph, if there is a map, it actually has then alt text to tell you where it is and what is available. Again, in our prep discussions, neither you nor Keely really had any alerts, did you, prior to evacuating?
No, similar to Keely, I wasn't getting any alerts. All the information that I was receiving was through friends and neighbors texting us.
I was going to say a similar thing. We also were only really finding out the information that we needed through Watch Duty, the nonprofit. We were also aware that a lot of our friends got false alerts too. So it was very confusing to know what was real, what was not. And that's why I think the work that the DCRC did was crucial and saved lives, because they got all of the information that was on Watch Duty, that was from county and city, and they put that all together in a consolidated, reliable form for people to understand. But no, we didn't receive any alert from the city or county. Thank you.
And then during our preparations as well, we discussed the attitudinal barriers that all of us have faced at one time or another, but especially during emergency planning and management. So I'd like to give each one of you an opportunity to tell me about your experience regarding attitudinal barriers and what recommendations you all might have to mitigate those biases in the future. Keely, you want to go first?
Sure. Yeah, I think there is an urgent need for disability and accessibility awareness training for all officials involved in emergency response. Attitudinal barriers and stigmas often result in disabled people being supported last, if at all. Disabled people are 2 to 4 times more likely to die or be injured in disasters, and I do believe one of the biggest barriers is attitudinal. Our lives are often seen as less valuable, and I think we saw this during COVID. Disabled people were deprioritized in healthcare and in public planning. The ableist mindset treats us as we are less important, and that is embedded within all disaster response, and it must change. Our lives cannot be seen and must not be considered less worth saving. I also believe that it would be very valuable for first responders to have some training around caregivers and the role of caregivers. We saw during the LA fires that caregivers were being denied access to cordoned off evacuation zones when they were trying to support their clients. And effectively, disabled people were being abandoned because they weren't able to get their caregiving support that they needed. I would also say that there needs to be awareness for disabled people as well on what resources there are for them, because as disabled people, we have been let down by so many systems that have been built and that are supposed to support us, whether it be the healthcare system, the justice system, whatever it may be. We have constantly been let down. So if we are notified and we are told that we need to evacuate by the system, it is likely that we're not going to trust it. There is a breakdown in communication. There is a big trust issue because we are let down consistently. So I think that training, that education, that awareness, it also needs to go both ways. I would also say vulnerability isn't a given. It is a consequence of systems that were not designed with us in mind. So as Lawrence also mentioned, disabled people must be involved in shaping the policies, in leading the conversations and building those solutions, and in that training that needs to be distributed to everyone, every single person involved in the emergency response.
Thank you, Keely. Molly?
Yes, I absolutely echo everything Keely said. I couldn't agree more. I think there has been, unfortunately, there is now a lack of trust in the community because of being let down so many times before. We heard about a blind man who, despite being in an evacuation zone in the Pacific Palisades, his wife and his son evacuated, but he did not, because he did not realize how bad it was. He did not trust the systems. And thankfully, before his building burned down, he was saved by the fire department, but that could have very easily been another disabled life lost. An attitudinal barrier that I faced that was a really, really big awakening for me, to understand how much other people do not think about the lived experience of disabled folks, was when we did choose to evacuate prior to being actually under evacuation orders. My partner had shared on Instagram that he was evacuating because when you're in these circumstances, you get so many calls and texts from people wanting to check on you, and you do not have time to update everybody that you're okay because you're trying to survive and get out. And so he was like, let me just post on my Instagram story so that everybody knows that we're out and we're safe. And he received a message from a friend saying, you know, you should take that post down because people are talking and they think that it's really like, it doesn't look good that you evacuated when you don't have to. And I was like, I don't think that any of them realize the increased risk that I am at as your partner, and therefore the increased pressure and burden on you as my partner to be the one to make these calls and keep not just yourself safe, but me and my guide dog safe too. They think that leaving, they called it a privilege, when choosing to try to save our lives is not a privilege. And within 5 hours, we would have been under evacuation and stuck in gridlock.
Right.
And so it was not a privilege to leave. We left because we knew that I'm at an increased risk and that we get left behind as a community. And realizing that none of his friends, it had entered their minds that our lived experience was different facing these fires than their lived experience as non-disabled people, made me realize why systems don't get put in place that protect us, because people do not think about us. They never center the disability experience when they think about these circumstances, and we need them to. And I really try to do everything that I can with my platform as a content creator. I'm a storyteller, that's what I do. And I try to share my own story, and I try to uplift other voices in the community as a way to try to get those who are not disabled or involved with our community to know our stories, to know us as humans, and to care. Because we need people to care, to have compassion, to have empathy, to build understanding, to actually want to create actionable plans and put things in place that protect us.
Thank you, Molly.
Yeah, I would just add that I think the biggest attitudinal barrier writ large is it disabled people, and I would even, there's a whole discussion out there. Do we say people with a disability? Do we say disabled people? I don't use either. I talk about disability communities because there's a heck of a lot of us out there. And the biggest attitudinal barrier that we have is that we're thought of as burdens and not benefits. When it comes to the planning, I would say, you've got to include us every step of the way from the beginning, from the get-go, through the phases of the implementation and the action plans so that you can make sure that all of those things that could go wrong don't go wrong. Because if you make something accessible for somebody like me or somebody like Keely or somebody like Molly, you're going to be also reaching a greater number of other people as well. That might be your mom, that might be your grandma, that might be you. And so it's really about understanding the benefit that disabled people bring to the policies and to the practices that evolve out of them. I would say also, we gotta stop thinking about this work as a burden that we need to do because those pesky people are going to sue us if we don't, and thinking about how this is going to benefit society, make the whole process easier. Don't wait, right? Don't assume that somebody is coming to save you. I think the one bit of advice that I would come up is say, have your plan, but also have plan B, plan C, and plan D, just in case those things don't go wrong. We learn to rely on things like old school terrestrial radio because nothing else worked, right? We would get in the car, we would turn the car on, and we would listen to the briefings at 11 a.m. and at 4 p.m., and we had a better sense of what was going on in the world. If you're deaf, that's not going to work for you. Right? And so it's about, BPR, Blue Ridge Public Radio, I'll give them a shout out, understood that if the cell phone towers are down, you're not going to be downloading photos on your phone. So they did a text-only version of their website so people could get information. It's about taking those lessons that we've learned time and time again from every disaster, whether it's fires, whether it's Katrina, whether it's Helene, whatever it might be, and saying, we've got enough data, now let's implement that information.
Exactly. Lawrence, thank you. What a great note to end on. It's, we've got a few minutes left, opening it up for any questions that the council members may have.
Well, I know that Theo had his hand raised, so Theo?
Yes, thank you. Amy, great panel, right? Thank you, Keely, Lawrence, and Molly. I'm a little angry right now because I'm in a crazy headspace. But I do know this. When I first came aboard on NCD, we was talking about this. And I guess we just got to keep talking about it until something get done. Obviously, we know that disasters is like taxes. It's going to keep on occurring. Right? And so it messes with me that we are not learning from this. And so, I know we know this to be true, that decision makers or anybody do what is important to them, what is a priority. And again, everybody said this, people with disabilities are not a priority. So I have this one question to Keely, to Lawrence, to Molly. Is what you went through preventable? I know the answer.
It is 100% preventable.
Yeah, I think in unison, we could all go, hey, yep.
Every disabled life that was lost was preventable.
Yeah.
None of those people had to die.
Yeah.
Yeah, better planning, better preparation, better participation. All of those things could have kept these problems from being what they are. I think that shift in thinking has got to go from, everything needs to continue to grow and evolve in time, right? For well over 30 years now, going on almost 40 years, the disability community had adopted a slogan that says nothing about us without us. I think it's time for an upgrade there. It's time that we start talking about nothing without us, period. Period. Because if you're not including us, if your plan, your practice, and your policies don't involve disabled people, then people are going to die and people are missing out. So let's stop thinking about these binaries about disabled people, not about disabled people, and assume everything needs to involve disability communities so that we can all benefit from it in the same way that we have from curb cuts and text messages and on and on and on. It's really time for nothing without us, period. And until and unless we do that, we're going to continue to see these problems.
Thank you all.
To second that, and I think that was so well said, and also I think, Lawrence, something that you mentioned earlier as well is we're so often looked at and seen as charity. I think organizations, governments, companies, they need to stop donating to disability and start investing in us, because we are the ones with the solutions. And as you also, Molly and Lawrence, as you both mentioned, what is built for disabled people is built
For everyone.
for everyone.
Well, we are pushing time. So I do want to say this conversation needs to continue with solutions that can be suggested. So I'm going to ask the staff of NCD to hold, I would like for all council members and to have a Zoom meeting with the panelists involved and talk about real discussions about how we can fix this. And we'll do it small, and then maybe when we're in New York, we can bring this back up and discuss this more at length and some of the findings and studies that we're looking at and real solutions to the problem, because I think that's where we're at.
Fantastic. Welcome the opportunity.
Absolutely.
Thank you.
So I do want to thank the panelists for being here. It was very informative, and this work will continue, and we will soldier on, and we'll make this work.